Naaalala nyo pa ba yung mga pa-commercial sa TV tungkol sa breastfeeding, sa pagbabakuna, o kaya yung mga promotional posters na nakikita ninyo sa mga barangay tungkol sa mga sakit kagaya ng TB, diabetes, tetanus at iba pa? Paano nga ba hinahabi at inaaral ang mga angkop na pamamaraan upang mapaunlad ang health literacy? Sino nga ba ang mga taong nasa likod ng mga ito? Ngayon natin malalaman yan sa third episode ng Trip to the Future. So good day once again to all our viewers and listeners. New day, new beginnings, and we have another esteemed speaker to speak with us now about the Department of Health, Education, and Promotion. I am Shane Perez, and today let us buckle up again, for we will be having another trip to the future. Together with us is our resource speaker from another essential field in public health, the health promotion and education. If you guys remember all those commercials in TV about vaccines, breastfeeding, and even the iconic 𝙤𝙖𝙩𝙀𝙁 slogan, I think you already would have an idea on what health promotion and education is all about. This field of public health is very vital in our health systems, as their primary aim is to create approaches and models for health promotion and education, promoting health literacy among the population. Our resource speaker for this episode is working as an assistant professor and the former department chair of the Department of Health Promotion and Education in the College of Public Health and University of the Philippines, Manila. He is truly an expert in this field given his almost 30 years of being in the field and his 29 published researches. Ladies and gentlemen, let us welcome Prof. Ernesto R. Gregorio Jr., Masters of Public Health. Good day po, Sir June.
Thank you. Good morning, Shane. So magsimula ako dun sa simula, no, kung bakit ako nandito ngayon. Malaking kinalaman ng aking nakaraan kung bakit ako nasa College of Public Health teaching health promotion and education. Actually, ang basic preparation ko ay mag-graduate of Bachelor of Science in Medical Technology from Manila Central University. Initially, I wanted to become a doctor, but for some strokes of fate, hindi natuloy yung aking pag-take ng medicine. I went on to public health. So ito yung simula. Nandun siguro sa hilig ko talaga yung magturo. And then I had this professor who really inspired me a lot. Siya yung teacher ko sa parasitology. She is a very good teacher and I would always look up to her kasi natutuwa ako sa kanyang mag-lecture. Pag uwi ko sa bahay, ginagaya ko siya. Nandun ako sa room ko, nagdo-drawing ako ng life cycle ng parasites. Kasi parang pinapractice ko yung sarili ko, preparing me to teach parasitology. And eventually, that happened, no? So parang may may inclination na ako na magturo. Yung likod ng pinto ng room ko, yung aking blackboard. Immediately after graduation, nag-externship ako sa UP PGH. So I took up 6 months externship training program in the Philippine General Hospital. Hindi pa kami tapos mag-intern, ni-recruit na kami yung batch namin. 3 ata kami in-invite sa Medical Center Manila to work as a medical technologist. Pero after 1 month, I resigned. Parang I did not like the atmosphere in the hospital. During that time, hindi ko masyadong feel yung mag-duty ka ng 24 hours, night duty. Parang hindi ako carved out for that. Hindi pa nga ako sumweldo, nag-resign ako. And then after that, I went to UP. Nakita ko yung isang announcement sa Department of Epidemiology that they were looking for interviewers. They were conducting the National Occupational Health Survey. So I applied as one of the interviewers. So it's really now moving towards to public health. So medyo nag-iba na yung aking career na pinupursu. Naging public health na siya because occupational health is a public health discipline. And then I went to the Department of Health Promotion. During that time, they were looking for a research assistant and medical technologies also. Dalawa yung research na ginagawa ko. Yung isa, knowledge, attitudes, and practices on mercury poisoning. So public health yun, we were going around gold mining areas because during that time, people working in the gold mining industry are suffering from mercury poisoning. They are dying, no? So we went around mining areas in Bicol in Mindanao, in Bukidnon, in Agusan, in Davao. So going to the mountains talaga, interviewing people about their knowledge, attitudes, and practices about mercury poisoning. No? There's also another study that is a sister study of that, neurologic and hematologic effects of mercury poisoning among small-scale miners. After that, I was recruited as a reps. So I work as a reps in the department. So I was the reps, the research extension and professional staff of the department. So I stayed there for 7 years. Nag-enroll ako sa MPH, sa College of Public Health. Part-time student ako until I was recruited by a pharmaceutical company. Now you know, very popular ang AstraZeneca. So I work in AstraZeneca. So this is also another opportunity for BS Public Health and Medical Technologies. So I work as a clinical research associate. Ang tawag doon CRA. I'm very lucky. That's one of the best moments in my life working as clinical research associate. So as a CRA, you will be responsible for monitoring the implementation of clinical trials. These are randomized controlled trials. No, these are the gold standards in research. So one of the best moments in life because of several reasons. Number one, if you're young and then of course you love to travel, that employment provided me a lot of travel, really many travels in Europe, in Asia, and in many parts of in Australia. I hope hindi naman mayabangan yung makikinig, no? Because I'm trying to inspire listeners. This is another area that you can work on and you also get to travel. So I retired from AstraZeneca after 7 years. I experienced burnt out, so I did not work. I did not want to work immediately. So I enrolled in the DRPH program of UP, College of Public Health, tracking in health promotion and education. And I was recruited in 2010 as a faculty. And since then, in 2010 until now, 2021, it's more than 10 years already. I'm still here. So if your passion is in teaching, so if you feel satisfied when you present to the class, if you have that sense of satisfaction, and especially if when your teacher says it's a good presentation and you feel that your classmates understood your presentation, then it's a sign that there's a call for you to become a teacher. Tatlo lang naman aming major responsibilities. Magturo, teaching or instruction. Number 2, do research. And number 3, do extension services. Because UP it's a national university, it's a research university, and it's a national university for public service. We do a lot of research. A good experience for me is that when I teach, I was able to experience a whole gamut of types of research. No, it's also one of the best times in my life when I did my diploma. My thesis is about evaluating the effectiveness of Bacillus thuringiensis as a control measure for mosquito. So yun, laboratory experiment yun. Kaya medyo strong din ang aking laboratory background sa research because of that experience. And then I was also exposed to public health, mga KAP survey. It's a kind of research na socio-behavioral. So another area of research naman yun where your subjects are people, not mosquitoes, no? And also, meron din akong exposure sa PGH during that time. Tapos meron din akong randomized controlled trial experience, no? Kaya nabuo ko yung nabuong cycle of the different types of research. Nagko-qualitative research din ako. So quantitative and qualitative research. So yun, pwede kayong pumasok as researcher, as faculty, as clinical research associate in multinational company. And then now, I am serving as a consultant. Financially, it's also rewarding. Lalo na yung mga professors, malalaking sweldo niyan. Ako, assistant professor lang ako. Pero comparatively sa ibang university, it's at par. Of course, money is immaterial. No? It's really not the primary consideration, but it will also help you survive. Because of course you have family to support. Right now, I'm doing a study on knowledge, attitudes, and risk perception on COVID-19 vaccines. So research can also bring you to places on top of contributing to body of knowledge that will help policy making and program improvement of the country. Once you go to public health, there's no going back. Parang it has always been an issue with graduates. Saan ba sila pupunta? Diba? After graduation, parang malabo yon. It was Ma'am Lynn Lorenzo that conceptualized the public health manager. The idea of Dr. Lorenzo was that the public health manager can be deployed. These are BS public health graduates. That after graduation, they can work as public health manager in rural areas, providing assistance to the doctors, to the barrios, or to the municipal health officers. So 5 graduates from BSPH were employed by that program. So they were deployed in different parts of the country, usually in 5th or 6th class municipalities, meaning to say very poor municipalities. And the result of that evaluation is very, very good. We also interviewed the doctors to the barrios, the municipal health officers, where the PHMs are reporting to. They all gave us a very positive feedback on how the PHM was able to assist them in improving the health system in their municipality. And then after that, the Department of Health, change nila yung public health manager. Yung PHM, naging public health associate. So the PHA is actually an offshoot of PHM. The role is actually very similar, to assist the DTTB to provide support by concentrating on public health programs so that the DTTBs, the doctors to the barrios, and the municipal health officers can concentrate on the clinical aspect of public health, treating patients, very clinical, so that the public health aspect work of the DTTB will now be undertaken by the PHM during that time.
I actually agree po with what you said na it's so hard to think of steps to take after graduating in BS Public Health. Kasi papasok ka ng public health na ang perception mo pre-med to. But then when you learn everything in public health, you get to see the bigger picture and how it actually affects the healthcare of every individual. So you end up having second thoughts about that.
Thank you, especially during the time of COVID-19. No, nakita niyo yung value, the importance of public health. Ano ba ang surveillance? Clinical ba yung surveillance? It's not medical, it's public health, di ba? Public health surveillance. Ano ba yung risk communication? It's public health. Ngayon, problema natin yung risk communication sa COVID-19 vaccine. Ano ba yung making people comply with wearing minimum public health standard, wearing of mask, wearing of face shield, practicing physical distancing. These are all public health measures. So very important, very crucial ang public health. If we have a very weak public health system, kita nyo yung mga lugar na very weak ang public health system, sila yung mataas ang cases ng COVID-19. So hopefully when you have this population health track, tapos with the universal health care, there's a big opportunity for you to work as a public health. No? Malaking role ng public health dyan sa universal health care. Kaya malaking opportunity. Pumunta ka sa mga NGO, ang daming opportunities for program monitoring, research, program evaluation, na talagang yung competencies ninyo as BSPH, very, very important, and that is what they like.
In relation po to the competencies that you mentioned kanina, as early as now, how do you think po can students better prepare themselves, like make themselves more competent and capable of handling work in health promotion and education?
Actually, our graduates, maski with the old curriculum, competencies is not an issue. Very competent ang graduates namin. I can proudly say that. I am proud of that in terms of research, in terms of program planning, implementation, and monitoring. Alam na alam nyo yan. No, I have no problem. Ang gusto kong inculcate sa puso ng mga graduates ng BS Public Health is more of the adaptive skills. Ang success ng isang tao, pwedeng i-summarize ko sa dalawang bagay. Or maybe tatlo, no? Number one, competencies. Dapat competent ka syempre, di ba? Pag incompetent ka, anong ma-output mo? And in terms of competencies, no question. Pangalawa, kailangan yung relationship. Kailangan makisama kayo. Magaling na kayo eh. So kailangan nyo lang improve yung pakikisama. Kasi pag na-turn off Sa interview pa lang, turn off na kasi nayabangan na sa inyo because you exude that kind of atmosphere pag during the interview na parang kayo lang ang magaling, tayo lang ang magaling. So, kailangan medyo i-tame natin yun. Ano? Pangatlo, very important ang mentoring. So, nung nagsisimula ako, may mga mentor ako. One of them is Dr. Tempongco. Kasi nga, di ba siya yung aking parang tinitingala as teacher. So, ginagaya ko siya. And then, nagkaroon ako ng opportunity to work under her. You meet people on your way up, don't forget them. And you always look back. You don't forget to look back.
Do you think po na you would have done anything differently in your professional journey given all the knowledge that you have now? Maybe to end this episode po, can we ask for your advice to us students aspiring to enter and excel in the field of health promotion and education?
Kanina banggit mo sa introduction na in the news ng health promotion and education because of the posters, the social media. Ay gusto ko lang i-emphasize na yung sinasabi mo is health education. Ang health education is all about behavior change. Health promotion is also more importantly looking at the environment that will ensure that behavior change will happen. Maybe you can convince people to wear mask for a period of time. But kung wala namang mask, di laging yung mask yung ginagamit nila na yung parang ang dumi-dumi na. Kailangan merong enabling environment so that mask will be accessible, face shield will be accessible, social and physical distancing can be done. Kasama din sa environment yung political environment, no? Dapat may mga ordinances, may policies that will ensure that there are measures in place. So health promotion is a very exciting job but very malawak, very broad ang health promotion because you are also addressing the environment. Kaya malawak ang napupuntahan ko. Ako, I can go from Zika virus to COVID to mental health to school health because health promotion is very broad. It's a very exciting job. It's very challenging also. But these challenges should not prevent you from doing your mandate, from doing your job, because remember, you're doing your job not because of only for professional growth, because remember that you are doing this for your higher goal, which is to help the country, to help the society, help other people. So yun yung aking parting words.
With everything you said po, we really can actually conclude that health promotion and education is crucial when it comes to public health. Especially po in times like this where it's basically the center of all our lives given the pandemic and honestly even beyond po. Thank you po Sir June for giving us your time and sharing with us your knowledge on the career opportunities in health promotion and education. It's been a very insightful and informative episode with you po, especially hearing from your journey as a professional.
Okay. Thank you very much. Bye-bye.
Thank you po.
ALAB Radio Trip to the Future is an initiative by ALAB College of Public Health in coordination with UP Manila CPH Student Council and UP Hygiene Society. This program is in partnership with ISEC, University of the Philippines, Manila, Alliance of Public Health Athletes, CPH Hydro, Public Health Artists Circle, Progressive and Responsive Organization of Pharmacy, Industrial Pharmacy Honor Society UPCP, CBOL PH, Staff CPH, in cooperation with UP Biology Majors Association, UP Manila Classical Ensemble, UPM Peer Empowering Peer Society, together with our media partners, SparkUp and WhenInManila.com.